Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic in ENT is otosclerosis. We divided our lecture into 5 sections. In the first section, we will talk about the etiology or causes of otosclerosis. And we will talk about anatomy of labyrinth in this top section and also about the basic overview of otosclerotic disease. Then in the second section, we will talk about different types of otosclerosis, and these include stapedial otosclerosis, cochlear otosclerosis, and histological otosclerosis. In the third section, we will talk about the signs and symptoms. And in this, besides signs and symptoms of otosclerosis, we will also talk about the pathology of otosclerosis and how otosclerosis develop. Then in the fourth section, we will talk about the diagnosis and treatment of otosclerosis, and we will also talk about some differential diagnosis of otosclerosis. What are some other conditions that can be differentiated from otosclerosis? And then we will talk about the stapes prosthesis, how we can perform after the surgical removal of stapes, what type of prosthesis is performed. Then contraindications to stapes surgery also. Then in the fifth section, we will talk about the stapedectomy, what are the steps involved in the procedure known as stapedectomy, and also what are the complications of stapedectomy. Once the surgery is performed, what are the different complications patient might have. So all this will be covered in our today's lecture topic, otosclerosis. To learn more about this topic, keep watching sqadia.com.